CEO of EazeBio. And we created EazeBio because that falls in track because it required a we simplify it and it's one and it's actually uniform and science that's speaking. So we did all the work for you. I have some slides. Let's see. With the next one. Oh, thank you. So let's see. Sure. Can you hear me now? Yes. So 20 years ago, I stood in a lab watching cells whispering signaling pathway. And back then, I was decoding antibodies. And I did not really know that it's going to echo to my future. Now I'm building a new language for health itself that translate biology, complex biology into simple sport and pure form. I'm going to tell you a sad, really sad fact, but this is what happening. We spend more than 8 trillion US dollar on chronic disease that we can prevent. The problem here that our current tool, the active, they measure damage, and we want to change that. We want to catch those early signals that body sent before the symptom appear. When you go to your doctor and you have symptom, it means the damage, they measure damage, and we want to go give you that signaling early on where you can actually reverse it. So this is how we're going to do it. As we all know, aging doesn't start with gray hair. Aging actually starts with inflammation. 70% of the chronic disease in adults start really with inflammation, and that starts actually AIDS before symptoms appear. With EazeBio, we want to change that timeline. And instead of aging that way, because of all that chronic disease and inflammation that been primed in your body, we want to help you to catch it earlier when it's still reversible. And how we do it is very simple. We created our home test. It's just like your high-tech pregnancy test, just a few drops of urine. You can measure multiple biomarkers. The first one is going to talk about our global biomarker. We have multiple patents on it. It's called GDF15, which is growth differentiating factor. It's elevated when mitochondrial basically dysfunction, or you have actually chronic inflammation, you have cellular stress, and that's where your GDF15 may find. When you capture that early on, that's what we call it your alarm, internal alarm system. So you can just visualize the result of. You can take a picture with our app and translate that picture of image where if it's possible, you can see two lines. If it's negative, you're only going to see the control. So if you're in your past, your iPhone, you enter beside your genetic data from the result. Since we measure metabolic stress for this space, you have to enter your lifestyle, your food intake, your exercise. And we have our own we're going to give you your metabolic. For example, imagine you're shopping. Your cortisol level will really elevate, and your app, our app will actually be able to detect that. And instead of just giving you track of your cortisol or stress level, it will surface a really personalized treatment based on your health dashboard that is already been accumulated in our app. So this is for testing, but also we have a panel that integrate reader, basically the test can be instrument free or with reader for deeper clinical insight. For physician, we really like to have that quantitative test. If it's just this or no, it's confirmation meaning for patient at home, it's great. But for clinician, we created the instrument which can translate that data you can see from your testing to really clinical level test. And I want to show you a few examples of what we do. So this is the full platform as we speak now. We do have actually four panels: one for women health, one for metabolic stress, one for cancer, and one for mental health. They all work the same way, or just as a standalone test, or we work also dedicated, or our test actually CE marks. We are the solving Europe and Middle East, and that's why we're launching your first one with covered India. So why us? Our patented AI and biomarker platform is not only rich your biology, but also created targeted treatment for you. We have so far 7 patents, and we implemented it where actually we make a huge impact in early detection. So basically, women health, infectious disease, cancer, all of those were really early intervention and changed the whole story. This is our first panel, which is actually your input stress, your metabolic stress, your solar stress. We have a panel of the biomarker along with static stress, like IL-6, CRP, along with the beta-17, that is actually the most specific biomarker for degenerative disease. So we just by adding all of those biomarkers together, we simplify the whole concept of what's going on in your body, not just the physical but mental. Because remember, mind and body connected. You really need a whole comprehensive analysis to understand or under stress and what triggered that stress. Is it inflammation? Is your mitochondria is not working, or just inflammation? Based on that, we can actually tell you, hey, this is what's happening, and this is the next step. And we're so proud. We just actually acquired a Nobel Prize winning innovation from UC Santa Cruz. This technology deployed where we can make the most impact was this surface connection. And why this is really important because as we all know, this is the most severe disease that even an hour delay in detection can actually increase the mortality. So what we do, our test, and it's the current test takes days to get the result. With our test, less than an hour. Our cost is around 10 to 20 versus the commercially available one is 300. So it's not only faster, cheaper, but it's also way more sensitive, 300x more powerful. And the sensitivity is higher than 95%. If you can ask me how I can achieve that would be 100x, this is actually based on the patent we acquired from a Nobel Prize winning technology from UC Santa Cruz. Okay, I'll go faster. So we basically, for this education, we combine the specificity of CRISPR, as we know CRISPR is the specific gene detection, along with our patent technology from UC Santa with the 300x signal amplification, and we created instrument test that could be in less than an hour tell you, hey, what's happening as far as your sepsis status. Do you have those antimicrobial gene in less than an hour? And this system actually built to scale. So you can use it in ER, you can use it at home, and this is what we are commercializing currently with the help of our. I'm going to skip where we are now, but I want to show you our partner. So that test that we were working on, we collaborated with UC Santa Cruz, Washington University, and GCC for to commercialization and starting clinical trials. Just a little bit about our team. We combine over 50 years experience in diagnostic, in clinical trials, and AI. And we have already launched multiple platforms, and we really know how to build the intersection of AI, digital health, and medical diagnostic. If I was to remember one thing from my whole presentation, that it's really we need to make prevention the standard. This is how we save life. So EazeBio, we're not only building diagnostic, we're actually building access. We're building the future where early detection and prevention is the standard. And this is how we're going to save our life. Thank you, everybody.